It all depends, and there's a lot of controversy on it. The biggest concern with prostate cancer is that we're still, a lot of the folks that are being identified with them are relatively advanced age. And let's say you're 75, 80 years old, prostate cancer tends to be a fairly slow-growing cancer. In fact, for most folks, it's probably about a decade between the time that they're diagnosed with it and the time that they might pass from it if it went on its normal course. That being said, I've had one guy now that's had prostate cancer for 20 years on that, and he was diagnosed late in life, and he's been pretty healthy, and now it has become more prominent of an issue for him, but he elected not to treat initially. There's also concern for older folks that the medications or the treatments have their own set of side effects. Some of them can be fairly debilitating. Things like prostate removal, which in some folks will cause impotency, trouble urinating, incontinence, those kinds of things. The medications cause side effects, especially things like hot flashes. I've seen a lot of guys have some muscle waste, because most of these are testosterone blockers, and so if you think about your testosterone help keeping your muscle mass up, and then you block that, folks aren't feeling all that, strong as they used to be, sort of thing. So it's imperfect. What I generally look at, if folks are in good health and we expect that they at least have a good 10 years life expectancy, then I think by all means get screened. It's important. People do die of prostate cancer. It's one of the bigger cancers that affect men and kill men. And it's not necessarily the best way to go. It goes into the bones, things like that, so it can be a painful disease. So I think for guys that are in good shape, don't have a lot of other medical problems, heart disease, diabetes, that kind of thing, really should be screened. Well, like everybody, folks are afraid of bad news on that, and it's not only prostate cancer, but it's things like colon cancer, breast cancer, mammogram, cervical cancer, things like that. Plus the exam itself, at least the digital rectal exam component, is something that guys don't necessarily look forward to, because it's a little bit invasive on that. I mean, I don't think it was a very painful exam for you,
right?
But it's still one that men generally like to defer if they can. Now, I've got a whole mixed bag. I got some folks that are just fine with the exam and the PSA. Some folks are a little bit more reluctant. Well, it's certainly better to identify things as early as possible on that. Now, again, depends. If you're talking about a healthy guy who's got a lot of years ahead of him, starting in the 40s to 50s, depending on family history and other things, it's a good idea to get it done. It's always better to get these things early so they can be addressed rather than for them to kind of become widespread and much more problematic. The digital rectal exam is not that painful an exam. Probably feels a little bit odd for folks, but
yes.
It's manageable on that. There are folks that just won't do the digital rectal exam. I'll still, if they're okay with it, run the PSA, the prostate-specific antigen, which again is a little bit incomplete in what it looks for. There's some debate on how great a screening tool it is, but it's sort of what we use on that. And I try to at least make sure they get the PSA drawn, even if they're kind of like not ready for the rectal exam. It's across all men in general on that. There are some that say if a guy lives long enough, he's going to get prostate cancer. It's at least has been said in the African American population to be a little bit more common on that. But I see all sorts of folks in my office, and I don't know that I've seen any one group more so than the other.